How's it going?
Hey, Jacquelyn. Pretty good. Snow day.
Yeah.
How are you?
Yes. Yes. I heard you had a little bit of a crazy morning. Thank you for, hopping on the
Yeah.
podcast. It is a crazy podcast week, so
Yeah.
a lot of talking.
Happy to be here. Yeah.
Awesome. Yeah, so I mean, there's we wanted to sort of take the in the headlines this week and talk about your story because the cover story with John Bird, people can go listen to the full thing on YouTube already. So we wanted to sort of dive into a different story
Yeah.
this week, and your story was super, super fascinating. I feel like on Friday we spent like probably an hour editing it, but it was mostly just because I was enjoying it so much,
Yeah.
like it was just, I had so many questions. But before we get into that, sorry, I got a little ahead of myself. I'll walk us through last week's headlines. The cover story last week, which I've now already alluded to, was a conversation with the Cancer Letter featuring John C. Bird, who was recently named director of the UPMC Hillman Cancer Center and associate vice chancellor of cancer affairs at University of Pittsburgh. Paul and Bird had a really great conversation about Bird's goals for UPMC. He's a blood cancer giant, and he's coming to UPMC, which is really renowned for its immunology and solid tumor work. So it's going to be a really cool mashup. Claire, as we'll talk about more, wrote a fascinating article about the storied history of the FDA and talc following the recent withdrawal of FDA's proposed rule that would have mandated asbestos testing in talc-based cosmetics. Finally, we had, or I guess also Sarah wrote a story about ESMO's recent guidelines on AI tools for clinicians, patients, and researchers. So it included chatbots and more like behind the scenes work, biomarker development, but all AI driven. That story was really interesting because the guidelines really broke down all of these different uses of AI in oncology and addressed safety concerns and current best practices for each of them. So that was fascinating. And we had a very rich cancer policy as always. So Harvey Risch, a critic of COVID-19 response or the COVID-19 response, who was interviewed for the job of NCI director earlier this year, he was tapped by the White House to serve as chair of the president's cancer panel. That technically hasn't been confirmed by the White House, but it seems pretty solid. I think he's just going through like final stages, and there will be an announcement soon. And yeah, there's more cancer policies, but we have a complex story to go through today. So I'm going to first just hand it off to you, Claire, to sort of give us the high-level overview because you're so familiar with it. And I'd also just really love to hear sort of like how this story came about, like the behind the headline type thing where, because I know that this was sort of a multi-week project for you in some ways.
Yeah. And I do want to say up front that there's probably questions that you have that I might not be able to answer because it is such a complex history. And I still feel very much like a kind of a student of this topic and a baby FDA watcher, I guess, if you will. But I guess it came up because, we saw that the proposed rule had been withdrawn. And the immediate alarm, I guess, from NGOs and health campaigners was, there's kind of an outcry. And so my initial response was, this must be highly unusual. Like, why would they, withdraw this rule? It must be political or something happened or industry influence or something. And I think the story initially was maybe just going to be a cancer policy or kind of a smaller B story. But I think as we talked to sources and started reporting it, it turned out to be like a lot more complex. And there's a lot of kind of shades of gray in the story and kind of the history of talc, why it was withdrawn. Maybe it should have been withdrawn. So there was, it turned out to be a much longer, I think ended up being more like 4,000 to 6,000 words type of story. And I think there was even more to say. Had it been a cover story, I think I would have tried to find kind of given more of like a comprehensive timeline and more of the history of the Cosmetics Act and all of that. But we kind of just jumped right into the proposed rule. What was it? What does it imply that it was withdrawn? And why was it withdrawn? So that's kind of the origin story. The proposed rule was just recently withdrawn last month. It was a proposed rule for standardized asbestos testing in talc-based cosmetics. It was mandated by the Modernization of Cosmetics Regulation Act of 2022, or MoCRA. And FDA withdrew the the rule, citing significant public opposition and unintended consequences. So I guess they had proposed the rule, and then FDA Commissioner Marty McCary held a roundtable, an FDA expert panel, or roundtable is what he was calling it, in May of this year, to talk about it. Brought on a bunch of experts to talk about talc. And after that, there was an open comment period where people could submit comments based on that expert panel. But apparently, after the proposed rule last year, there was also an open comment period. And taking together all of those, I guess, responses to the proposed rule, FDA decided to withdraw it in order to, in their words, rewrite a more comprehensive rule, which is forthcoming, apparently. So that's where we fell into the story. Was they had this proposed rule. I had covered the talc panel back in May, which was really interesting. There was a lot of stuff about talc that I didn't know, food-based talc versus industrial grade talc, and how, there really is no safe level of talc. It occurs naturally alongside asbestos in many cases. So asbestos contamination in cosmetics has a long and kind of sordid history. The EU is banning it in 2027, I believe, just completely banning it. And a lot of experts and epidemiologists believe that it should be banned here as well. So I guess I'll just say one more thing and then I'll let you ask questions. Going on and on here, but the last thing I'll say is just that the important thing is that nothing has really changed. It was just a proposed rule. So the rule was not finalized. There has been no standardized testing for talc. That is very much voluntary. Cosmetics, we've known that cosmetics can contain contaminated talc for many, many years. So a lot of companies are very upfront about this. It's had a lot of publicity. One of the Kardashian sisters was involved in kind of raising awareness about this. So it is possible to find, companies that are really transparent about whether or not they use talc. So I'll kind of stop there. That's kind of a really, really broad overview, but my brain is just kind of like.
I know. I honestly feel the same way. I think, honestly, maybe not having so much context is actually helping me see it a little bit less overwhelmed. But it is, I think, just such a complicated and complex story. And when I was reading it for the first time, I think and maybe this echoes your experience a little bit too, where, I remember a lot of quotes and sort of what you said about this sort of outrage. So many different quotes were saying that this withdrawal of this rule is like dangerous and risky and I forget the other words, but a lot of really,
reckless.
Really strong adjectives. Yeah. Reckless. Thank you. Yeah, exactly. Yeah. And I mean, when you read the headline, they're withdrawing a proposed rule that would regulate asbestos, it's hard to see how that could have maybe a less, malicious, or not malicious, but you know what I mean? Insidious spin. But like you said, it's so complicated. And so I just want to sort of tease out, if you can, and I think I don't want to put you on the spot, but maybe sort of that other side that you got to later in the story about how, if you do trust that FDA is going to put out another rule, which a lot of our sources did have some maybe concern about whether that actually is forthcoming. Yeah. But, just hearing sort of maybe the other side of it briefly, and then I do have more questions.
Yeah, no, that's fine. I can kind of get into it. It is really complicated when it comes to, I guess, the methodology for testing for asbestos and talc. So the initial proposed rule, which was a Biden-era rule in 2024 of last year, November 2024, it would have required manufacturers of talc-containing cosmetics to test each batch of talc or the finished product for asbestos contamination using two different methods. The first was polarized light microscopy, and the second was transmission electron microscopy, which, from my understanding, are imaging techniques that allow you to look at the structure of a specimen under a microscope. So the public comments were multifarious, and I think some of them were publicly available after the initial 2024 rule. I know one of my sources, John Joseph Godleski of Brigham Women's, told me that he was one of the initial responders, I guess, to the rule, pointing out some of the flaws he was really forthright with me. He was at the panel, actually, the expert panel. And he said straight up that there was some significant problems with the initial rule and that it actually would have ended up favoring the industry. And that it really needed to be fully withdrawn in order to be scrutinized and rewritten. His, I guess, main hang up with the rule was that it would have created the potential for false positives. And it had to do with, missing kind of the nuances of asbestos, the nuances of the amount of fibers that could be found in talc-based cosmetics, like either 0 to 100, I think is what he was saying. If it's 100% talc contamination, asbestos contamination, that would have missed kind of everything in between, if that makes sense. It just wasn't nuanced enough. It wasn't comprehensive enough. So his belief was that this was actually a really fitting response to the open comment period, and that he's confident that a more comprehensive rule is forthcoming. A lot of, I guess, insiders, FDA watchers, I'll call them, pointed out that FDA is legally required to issue this rule. They are mandated by the Cosmetics Act. So, I mean, I guess that's the good news, is that the administration has to propose another and hopefully better rule. And I guess the concerning news is that there's no timeline for when that's going to happen. So in the meantime, it's voluntary, and it's up to us to kind of decide what's safe.
Well, that was actually going to be my next question, and again, you're not able to give advice, we are just reporters. But, as I was reading the story, I think one of my first questions was like, well, what do we do in the meantime? Like when there's no oversight, I feel like it's just a little scary, to think about. And like you said, I think it was, and again, I'm not deeply in the story, so I feel that I could be missing nuance even in these questions. But, like you said, not much has actually changed because it was voluntary before. Yes. Correct. So just,
Exactly. Yeah, no, nothing has actually changed. And I mean, the Environmental Working Group, which is one of the health organizations, nonprofits that kind of called this reckless, dangerous, and really took issue with it, was pointed to some of their apps and databases that you can use to kind of like plug in your cosmetics and see if they are on a concerning list or something. But yeah, nothing has really changed. It was just a proposed rule that had not been finalized yet. I think it was more the optics for a lot of these organizations, to withdraw a rule that felt like a lot of progress. The initial proposed rule was pushed forward by a lot of lawmakers who've been working on this for a long time. So just to kind of withdraw it, there's a legal notice in the Federal Register that answers some questions, but it is, it's vague. And so I think it requires some, I guess I find myself at this place where, we've been writing about, Trump's FDA, and we've been watching the internal kind of turmoil at FDA. And so it's hard to not, with all of this like staff turnover and all of this upheaval, to not question kind of every action and assume that there's something maybe unseemly going on. But I think in this case, it really does feel like this is not an abnormal way to go about rewriting a rule or writing a rule that, withdrawals happen. It's part of the kind of protocol. And just, I didn't dive too deep, but if you look back a little bit into just thinking of the history of FDA, this has happened before. It's not unusual to withdraw a rule in order to rewrite it. So yeah, I will point out, and I can't really talk a ton about the industry side of things, but one of my sources did point out that this kind of reprieve will benefit the industry. There's a long, again, sordid history of Johnson & Johnson's talc-based talcum powder, essentially, and 67,000 plus lawsuits, depending on who you talk to, still pending against that company. And any reprieve with this rule withdrawal will end up, benefiting them and helping them kind of claw back credibility from the jury and the courts. So
like you said, we can't really dive too much into that right now because we have not done the reporting, but it's an important consideration, I think, just to mention. The last thing I want to ask you, Claire, and this is kind of going backward, and I hope there's more to say. If there's not, we can go in another direction. But I would like to talk about cosmetics at FDA, because we don't ever, or I've never looked at that really. It's always been drugs and I guess biologics and devices to an extent, but cosmetics is something that I've never explored or looked into. So I'm wondering what you learned about that in doing this story, and also, just how it relates to the story.
Yeah, for sure. I know a little bit about that based on my reporting. And so I guess the big thing is that FDA's legal authority over cosmetics is very different from their authority over other products, such as drugs, biologics, and medical devices. So under the MoCRA law, cosmetics products and ingredients, they don't need FDA pre-market approval, with the exception, I believe, of color additives. But FDA can pursue enforcement action against products on the market that are not in compliance with the law, or against firms who, or individuals who violate the law. So currently in the US, testing is voluntary. Multiple sources said to me that the cosmetics, I guess branch or area just has very, very little power.
That's fascinating. I wonder, I'm feeling a new special interest to come about. I want to learn all about it, but I have to figure out a cancer angle so I can do it during work. But that's awesome.
I think we had talked about this while we were editing my story on Friday. And I kind of have to look at my notes for it because it's really complicated and I don't want to, use the wrong words. But something that kind of, I think, blew both of our minds was that that cosmetics companies have known since the 50s that asbestos can contaminate talc. Public was alerted in the 1970s. However, multiple investigations have shown that the industry persuaded FDA to kind of allow companies to rely on test methods that can detect some, but not all asbestos fibers. So at least since the 70s, it sounds like FDA has downplayed health concerns around talc. And, I'm to their credit, Trump's HHS, McCary, especially kind of came in to the agency with talc was one of kind of the cornerstones of his, MAHA agenda. Aside from, it being directly linked to various cancers. A lot of the sources and experts at the panel said it has, other implications as well, that it can cause inflammatory diseases and it can cause things like Crohn's. And all kinds of issues. And another interesting point that I think surprised even the epidemiologists at this panel was that how abundant talc is. So it's like on chewing gum, that kind of that white powder that keep your chewing gum from sticking to the paper. We know it's in rice, but it's on a lot of candies. So it's kind of one of those things that it really deserves some serious scrutiny. So I'm glad we're talking about it. And I want to continue, following this story because it's really unfolding and it's been going on for decades.
Yeah, absolutely. It's so funny. You told me that on Friday about the chewing gum and I went to the grocery store and I was like, I literally looked at the gum. I was like, do I want this? I don't know.
Yeah.
So it is a thing. Yeah. You gotta, so I'm glad that you'll be watching it. I can rely on you to give me the news.
We've been chewing gum from this organic kind of co-op nearby for a long time. And I will say, gum without talc, gum without plastic in it is not as fun. You can't blow bubbles, it's really a bummer. But having young kids, I was, really, I didn't even know about the talc bit, but I knew about, microplastics and stuff like that being in gum. So we've been eating the pure gum for a long time, but it is disappointing. Yeah. It's nothing like, what we grew up with.
I know, what is it called? Hubba Bubba?
Juicy fruit, I was thinking, or the zebra stripe, the zebra
yes.
with the tattoo on it.
The tongue tattoos were my favorite.
They were the best. Yeah. R.I.P.
Awesome. Well, what a nice note to end on after a maybe potentially not so fun conversation. But lovely. And thank you so much for joining me, Claire. I know it was sort of a crazy podcast week, but I appreciate you. No. And I will see you soon.
Sounds good. All right. Bye.